Good afternoon. Our board continues to analyze data and seek input from healthcare professionals both at a state and local level. And you can see this data that we consider on our website at www.oxfordms.net. Just click the orange bar that's at the top of the page and it says updates on COVID-19, and you can follow along on the charts. You will see there that we have had 14 new cases in the past 8 days. This increase in numbers is not a surprise when you consider all of the reopenings that have taken place in the past 2 weeks. We continue to monitor the number of COVID-19 patients in our hospital as well, and have been encouraged that this number has remained steady even with the increase in cases over the past week. The Board of Aldermen met yesterday to review the governor's latest executive orders that open up all businesses with restrictions today. We have been asked why we don't just adopt the executive orders issued by the governor and move forward, why we feel like we should impose stricter guidelines. So I wanted to address that. We have seen, and you've seen in the news, that COVID-19 is impacting regions of our state in different ways. Each community has its own unique population makeup. While recognizing this reality, we have set cautious, thorough requirements for Oxford. The governor, also knowing that this is not a one-size-fits-all issue, granted in the orders the authority for municipalities to make these calls as they saw needed. We have had more stringent requirements in some instances, and we have seen great success in managing the positive caseload and flattening the curve so that it has remained manageable for our healthcare system, and that is a credit to our citizens, and we thank you. There are some dire consequences to opening too soon. Opening public spaces when social distancing is difficult to maintain has consequences, and honestly, we're seeing some of those now in our rising numbers. I've stressed the impossible balance of our economy versus public health, and it's such a hard balance to find, but we do know that reopening too soon is a dangerous gamble. However, sheltering in place is just not sustainable anymore. So that's the charge of our board, to determine how to reopen in the safest and most successful way we can based on input from professionals. One of the safety measures that our board believes is a key to success is face coverings. I know face coverings are so difficult, they're so hot, they're so cumbersome, they're so frustrating, and we completely agree. But face coverings are still required inside all businesses by employees and customers, and in areas where social distancing can't be managed. I know I'm not going to try to make you like it. We don't like it either, but I want to stress that face coverings are required in restaurants and bars except when you're seated at a table. I know that there are those who believe that this is an infringement on their rights, and although I don't agree with that, I understand the claim. It's not the goal of this board to be overbearing at all or to put in place unnecessary requirements, but it is not only the authority but also the responsibility of this board to make hard decisions, even if they aren't popular, if the board believes that data supports that these measures are critical for our public health, and we do. We continue to seek advice from the CDC, from the Mississippi Department of Health, and local health care providers, and continue to be advised that the best tools for successfully reopening the economy are face coverings, social distancing, and washing our hands frequently. I want to also stress that this is not going to go on forever, we promise. We will revisit the need for face coverings at every meeting. It will be on the agenda for our meeting on June 16th. And if we are advised prior to that meeting that they are no longer recommended by healthcare professionals, then we'll call a special meeting to adjust. I've been asked what data is being considered as we move forward. What would cause us to become more stringent again, or what would trigger loosening the requirements? Well, we believed in the beginning that we could define a phase 1 plan with a list that we would need to accomplish before moving on to phase 2 and so on. Well, we quickly realized that this was just not realistic. I think our national and state leaders realized the same, and that's why we see plans that are evolving daily. There's so much gray area. Recommendations are changing often, and we're trying to change with them. We'll consider lessening our requirements when we see a downward trajectory of documented active cases and a decrease in emergency department and/or hospitalization for COVID-19 illnesses. Our board fully understands the importance of slowly reopening to ensure success. fall season in Oxford is critical for our economy, from rental properties to hotels to restaurants to nail salons. Our businesses depend on the extra population that the fall brings in students and in visitors. Please help us ensure our success. Please continue to hang in there with us. Our community is special for so many reasons, but the people are the best part, and we are stronger together. Thank you.